Right.
Yeah.
Hello. She does want to go up here. So I'm going to look over the bills and just to do a record.
Anyone here? They can even like come up here for a moment and then get
Oh, sorry. Just making sure that wasn't.
Yes.
All right, Scott, here we can get started.
Oh, yeah. Odd for do that. Use some of the maybe
Welcome to this meeting of the Joint Standing Committee on Health and Human Services. Detecting the presence of a quorum, we're going to get started, and I wanted to get started before maybe we didn't have a quorum. But we're going to begin with introductions from the committee, starting from my left, going to my right, ending with our House Chairman and myself.
Good afternoon, everybody. My name is Christine Burstein. I live in Lincolnville, and I represent District Number 96, which encompasses 7 towns in Waldo County.
Good afternoon, I'm Karen Vachon. I represent House District 29, which is coastal Scarborough.
Good afternoon, I'm Scott Hammond. I represent District 32, South Portland, Cape Elizabeth.
I'm Senator Ann Haskell. My district is part of Westbrook, part of Portland. I will apologize to people. I am eating in the committee room. It is impolite for the people who've been waiting for us. However, based on the schedule today, I'm going to continue until I have eaten my lunch.
And holding up this end of the horseshoe, I'm Patty Hymanson. I represent District 4, which is parts of York, Wells, Sanford, and all of Ogunquit.
Good afternoon, everybody. I'm House Chair Drew Bettine. I represent the south side of the city of Westbrook.
I'm Senator Eric Brakey. I'm the Senate Chairman for the committee. I represent the people of Auburn, New Gloucester, Poland, Maine, and Mechanic Falls. And we're going to go ahead and get started. The purpose of the hearing is to invite testimony from members of the public regarding proposed legislation that is pending before this committee. The committee will hear testimony from persons present who wish to speak for, against, or neither for nor against the bills to be heard today. With leave of the chair, committee members may ask questions of any person testifying today. Other questions are not permitted. Whether or not you testify, you may submit written testimony to the committee. Please be mindful that testimony is public and is available to all once it is presented. Written testimony will be distributed to committee members and will also be posted on the Legislature's website for viewing by interested persons. Persons testifying at the public hearing today are advised that the hearing is being broadcast on the internet and may be heard by persons listening online. If you wish to testify, please state your name, residence, and the organization you represent, if any, and sign in at the podium. The testimony will be heard in the following order. The sponsor who will present the bill, followed by any co-sponsors, those speaking in favor of the bill, those speaking in opposition to the bill, and those speaking neither for nor against the bill. If you have any written materials to accompany your testimony, please give at least 20 copies to the committee clerk prior to testifying. I'd also like to introduce our committee clerk, Annie Lori Buckman, in my left corner. So if you have testimony, you can give that to her and she'll give it to us. Also, our committee legislative analyst, Anna Broom, in my right corner. A couple of housekeeping notes. In this committee, we do observe time limits on testimony. This is so that we can make sure that everyone who is here to testify will have an opportunity to testify, and that we everyone has an opportunity. Also, the way we will be proceeding on the bills in front of us today, since all of the bills are in and around some of the same topics, we are going to be doing all the bills in one hearing. So that means I'll read off the bills. We will be doing LD 101, an act to strengthen and reform Maine's welfare system. LD 133, a resolve to establish a task force on independence from public assistance. LD 452, an act to require a work search for job-ready applicants for benefits under the Temporary Assistance for Needy Families program. LD 816, an act to reform welfare and eliminate the welfare cliff. LD 885, an act to promote enhanced eligibility verification in Maine's welfare system. LD 1097, an act to improve the integrity of Maine's welfare programs. LD 1144, an act to ensure the integrity of the Temporary Assistance for Needy Families program. LD 1268, an act to reform welfare by establishing bridges to sustainable employment. LD 1375, an act to increase accountability of Maine's welfare program. So the way we will be proceeding is we'll be hearing from all the sponsors at first, not at the same time. They can come up individually, and they don't need to talk over each other. But all the sponsors for all the bills. Followed by that, we'll hear from any legislative co-sponsors who wish to testify. Followed by proponents of the bills, opponents of the bills, and individuals neither for nor against the bills. Now, since we're dealing with multiple bills, of course, you might be for some and against others. So in that case, just make your use your better judgment. We'll go easy on you. Because we are combining the bills, the time clock we are using, normally we have a 3-minute time limit on testimony, but when we are combining multiple bills, because we understand that there might be, if there's more than one bill to comment on, we do expand that to 4 minutes. If your 4 minutes is coming up, you'll be able to see the time clock running down. If you get there, we would very much appreciate that you take notice of the clock and wrap your testimony up by the time you get to the end of the 4 minutes. If you have not wrapped your testimony up, I will politely remind you to wrap up your testimony. And I always say I'm going to be kind of hard-nosed about it, but really I'm not mean enough to do that, so I'm just going to ask you very nicely. And I think one thing, I don't think this will be a problem, but it's always worth stating for public hearings, especially public hearings on issues that people might be very passionate about on one side or the other. We always, this is a room of mutual respect for everyone, and so we ask that there be no outbursts when someone is at the mic. That could be an outburst, no outbursts of applause, no outbursts of booing, no. So everyone will have their opportunity to share their thoughts on the proposals in front of us, and that'll be when they're at the microphone. So we'll go ahead and get started. So we will begin hearing from bill sponsors to present the bills. And so bill sponsors who are here already, could you raise your hand just so I see who we have working with? I guess I'm one. You're one. Yeah, I guess I'm one too. So I'm going to invite Senator Katz to go first. We'll be very brief.
Thank you very much, Senator Brakey.
The mic isn't on. You could reach around back. Or,
It's on. Good test. It's attached.
This is the first test. Can you pass the compliment?
Failed miserably. Thank you very much, Senator Brakey and Representative Bettina. My name is Roger Katz, and I represent Augusta and surrounding towns in the state Senate. I'm here on the third bill, and I'm going to try to make your afternoon a little bit easier by asking you to vote that out unanimously, ought not to pass. And the reason is that although I think it's a good bill with respect to work search requirements for TANF applicants, it's contained as a part of another bill, essentially exactly the same concept, and there's no need to have this one heard separately. Thank you.
Thanks, Senator Katz. Any questions for Senator Katz? Representative Bettina?
That's the third time we've done this now.
I only counted twice.
It's good for our numbers, though. It doesn't remove stuff fast.
Any way I can help, Representative.
All right. Thank you, Senator Katz. Next, we'll hear from, let's see, bills in order. We have, so let's take so Representative McCabe, and then we'll take Representative Espling.
Senator Brakey, Representative Gattini, distinguished members of the Health and Human Services Committee. I am Representative Jeff McCabe of Skowhegan, representing a portion of East Madison as well as the entire community of Skowhegan, residing on the south side of Skowhegan. I wanted to just point that out for Representative Gattini. I'm here to present LD 1144, and here to present this bill. This is a bill that attempts to prohibit the use of electronic benefits at such tobacco specialty stores, and also creates a list of prohibited uses as well. I think you're going to hear a number of these bills today. I think it's important as stewards of taxpayers' dollars that we have this discussion. And really, I don't look at this as the entire solution. I know that this committee is taking up a number of bills. I'm a co-sponsor of Senator Katz' bill in regards to junk food, and really feel that we should prioritize to make sure that we're providing nutritious food under these programs. And also, at the same time, I think it's important that this committee, as well as the department, be proactive and look at such bills as Senator Johnson's bill that directs the Department of Health and Human Services to create a working group to really look at ways that we can be doing a better job of providing access to food. I represent a service center community with access to, food options. We also have a large supermarket, but some of the outlying towns and some of the folks that live around us really don't have many options when it comes to purchasing nutritious food. So I think that anything that the committee can do to help promote such efforts as Senator Johnson's, in tandem to these other efforts, may be something that the committee should really look at. And I think that some of these bills are very focused, and I think we need to think broader as we think of food security. I also encourage you to read through the recommendations that are listed in my bill in regards to any violations that are being proposed, because I feel that the violations, if there is any, and any of these infractions, need to be appropriate and also need to include education. I think that all too often we just want to look at the penalty aspect of things and really not look at the opportunity to move people forward through education and really to help folks sort of better their lives and better the lives of their children. So that's another reason why I present this to you today. I'm happy to take any questions.
Any questions for Representative McCabe? Seeing no questions, thank you very much.
Thank you all. I appreciate it. Thank you for your work today.
So we hear from Representative Espling.
Thank you, Senator Brakey. Senator Brakey and distinguished members of the Health and Human Services Committee, I am Ellie Espling, and I represent House District 65, which includes New Gloucester and part of Poland. And I am here today to present LD 885, an act to promote enhanced eligibility verification in Maine's welfare system. Quite simply, this bill would require the Department of Health and Human Services to determine the eligibility for benefits of a recipient of assistance on an annual basis. In talking with folks from the department, it seemed unclear to me how often eligibility is reviewed and if it is standardized throughout the department. I believe eligibility should be looked at on an annual basis for each recipient so that a redetermination of benefits can be done for these folks. We file our taxes yearly. Some of us with college-age students have to file a FAFSA on an annual basis. So I think an annual determination of benefits will serve two purposes. It would make certain that benefits are determined regularly so that the consumer can get access to what is most helpful for them at that time. And also it would make certain that those who no longer qualify for benefits do not continue to receive those benefits. The state of Illinois has made redetermining eligibility a key priority through their redetermination project, which will improve Medicaid integrity by validating that clients who qualify for medical benefits receive them, while those who are not qualified are disenrolled. While the Illinois initiative really seeks to drive down Medicaid costs, doing something similar in Maine for all programs should help drive down costs while also ensuring that those who are in need of services get what is appropriate for their financial situation. So I would be happy to try to answer any questions.
Thank you very much. Any questions for Representative Espling? Senator Haskell.
Thank you. Representative, did you intended this to be focused on the Maine Care program?
Not necessarily. I mean, I'm open to what the committee would see fit. I would certainly hope that an annual determination would be able to be made for most people that are accessing services in whatever area that might be. I'm just unsure of what the department can do to be able to manage that.
Okay, thank you very much.
Yeah.
Representative Vashon.
Enlighten me of what the eligibility program looks like now. You become eligible and then what?
I am unsure. That's why I put this bill forward. I think that if someone is made eligible for services, that eligibility should be looked at least on an annual basis. It seemed unclear to me when that actually is reviewed. And so I'm sure you'll hear from the department as to what they actually do in practice.
Seeing no additional questions, thank you very much, Representative.
Thank you.
Next, we'll hear from Senator Alfond on LD 101.
Senator Brakey and esteemed members of the Joint Standing Committee on Health and Human Services. I am Justin Alfond. I'm a resident of Portland, and I'm honored to represent Senate District 27, which includes most of Portland, the islands of Peak, Cliff, and Great Diamond. Today I'm pleased before you as a sponsor of LD 101, an act to strengthen and reform Maine's welfare system. Earlier this session, I put in this title because no party supports fraud. I believe that Democrats need to have a seat at the table and work with the governor and Republicans to make meaningful reforms founded in evidence and data. Again, nobody supports fraud. I hope that everyone in this committee in Maine can support evidence-based policies that reduce the high poverty rates for single families with children. A plan that reduces costs while investing in people and helping them become fiscally sustainable. A plan that offers hope and a path forward in life. That plan, this vision, is already in a bill put forward by Representative Gattin and Senator Haskell, LD 1268. I would encourage the committee to fully support this bill. You all know this, but there's no single issue, no challenging facing this state in Maine that is politicized as much as welfare and welfare reform. There are well-meaning people serving in elected office that come at this difficult challenge from different perspectives that share a common purpose, to help those among us with the greatest need become sustainable and financially whole. I'm confident in the spirit that we can enact meaningful reforms that we all can be proud of. I'd like to thank the committee for your time and to be very crystal clear in asking you to kill LD 101.
All right. Questions for Senator Alfond? Seeing no questions.
Thank you.
Thank you very much. Let's hear from President Thibodeau.
And good afternoon, Senator Brakey, Senator Haskell, members of the Joint Standing Committee on Health and Human Services. I'm Mike Thibodeau, and I have the privilege and honor of serving as President of the Maine Senate. And I'm here to present LD 1375, which is the governor's bill and act to increase accountability in Maine's welfare programs. And let me begin with one thing. Let me be clear. I'm asking you not to kill this bill, but instead do something really good with it. I believe that every single person in this room that believes that Maine's welfare system could be improved significantly. Maine's welfare system is broken, and because it is not helping people move towards self-sufficiency at a rate that it should. It's time to bring accountability and logic to our welfare system and our welfare spending. We have made significant strides since 2010, but there's far more that needs to be done. This bill would continue the momentum for welfare reform by requiring some common sense actions on the part of temporary assistance for needy families, or the TANF program, applicants and recipients. Folks who meet the Department of Health and Human Services definition of job ready, meaning that they are in immediate danger and that they're able-bodied and would be able to apply for a job before receiving benefits. Requiring a person to search for work before receiving benefits would align Maine with the federal government's standards It is important that we align with federal standards because we have been fined millions of dollars, as we all know, in the past for failing to align, and now put the state in jeopardy of being assessed even millions of more dollars in fines. And the federal government is fining us for how badly we're taking care of their money. We ought to take a long look at this and see what kind of job we're doing. That's a pretty clear incentive for us to make some simple changes. This bill would impose a number of restrictions on spending of TANF benefits, including spending on tobacco, alcohol, gambling, lottery, tattoos, and bail. It would restrict recipients from spending their TANF money outside of Maine, and it would not allow recipients to withdraw over 15% of their money, their monthly benefit in cash. Another key provision of the bill would terminate TANF benefits 6 months after the third disciplinary sanction. I want to note that these changes will all save money out of our federal TANF block grant. These savings, among other savings, realized from the reforms, such as imposing a 60-month cap on receiving TANF, will be used to create a stronger incentives for folks to move from dependency to self-reliance. Instead of blindly throwing money at the problem, let's continue the new normal of good governance and smart incentive structures for our welfare programs. Make no mistake, many of us campaigned and went out and knocked on doors, and to a person, I think we all had folks that we met at them doors suggest to us that it was time for us to take a serious look at welfare reform. I think that the climate's right, as Senator Alfond just alluded to. I don't believe that there is anybody in this building that doesn't recognize the necessity and indeed the opportunity we have to work together to enact some meaningful, much-needed welfare reform. So I would encourage this committee to take this task on and work incredibly hard, because I can't think of a more pressing issue before us than this issue. And folks at home are demanding that we truly take the issue on and deal with it in a serious manner. And I know each and every one of you will. With that, I would welcome any questions.
Questions for President Thibodeau. Representative Vashon.
Thank you for bringing this bill forward. I was wondering if there was a model state that you looked at for how they manage their welfare benefits. And looking at the restrictions that you've got in this bill, I was wondering if they were aligned with a lot of other states.
Right. Well, most of what's in this bill actually is a result of federal guidelines, ones that we're not meeting, and ones that we truly should be meeting. I mean, when you've got, as I said in my testimony, when you've got the federal government threatening to assess damages, fines against the state of Maine because of our lack of compliance with federal programs, that's a problem. And I think we're all aware of the fact that TANF benefits are for temporary, for needy families, and the idea is it's supposed to get you back to work. And you guys will be dealing with some other bills that encourage people to be able to really improve their own situation and not be cut off with by a cliff, allowing them to work their way back into the workforce and prove their worth to their employer without losing their benefits immediately. I think that that's another bill that I don't know if you'll be using one vehicle for all this or if that will be a separate issue, but there's plenty of low-hanging fruit, stuff that we all can agree on, stuff that we desperately need to do. But again, it's really about aligning ourselves with federal guidelines at this point, and that's what we're attempting to do here.
Yes, Representative Vashon.
So, is there a model state that you know of that, I guess that's probably,
I guess I didn't want, I wouldn't suggest to you that this is modeled after any one state, but instead the federal guidelines.
yeah, I was just wondering if looking across the country when we're coming to the table with ideas, I'm often looking and saying, what are other states doing?
Right.
And this state's really, really figured it out. This state's figured out a way to avoid the welfare cliff, to incentivize and motivate people to go back to work where the benefits aren't so rich in a welfare program that it decentivizes them from getting a job. So it's just, it's just always easier when you've got a role model to lead you.
I'm sure that there are plenty of other states that we could look to as, that are probably doing some stuff better than we are. There's also a whole long list of pitfalls that we don't want to go down. But I'll leave that to the committee to figure out which states may be doing it right.
Great, thank you.
Representative Burstein.
Thank you. Welcome, Senator. It's nice to see you. I have two questions. One is this a lifetime cap on TANF or just the 60 months?
I believe that's a lifetime cap.
Lifetime cap. And my second question is, do you know specifically, maybe somebody else can answer, what are we not meeting now as far as federal guidelines?
One of the things, Representative, that we're not meeting is the obligation for people to be actually looking for jobs. We give them TANF benefits, and they're not meeting that responsibility of being out and being part of the workforce, looking for gainful employment. And that's one of the things that we're facing fines based upon. So we need to do everything we can to make sure that we're in compliance.
Are there any other ones that do you know?
I think that's probably the primary one, but I'm sure that folks that have studied this will have a lot more places where we're falling short. That's one of the primary ones.
And do you know what the fines are?
My understanding is it's tens of millions of dollars.
Thank you.
And for clarity's sake, correct me if I'm wrong, Mr. President, the 60-month cap on TANF benefits is not in this bill. That's already been passed into law in the 125th legislature. That was referenced as one of the, if I'm correct, that was referenced.
I believe that's correct.
One of the previous reforms, that's already done. But Representative Hammond.
Thank you. Could you describe for me a little bit about the good cause exemption? I'm not familiar with that.
So my understanding of the good cause exemption is that essentially it's unenforceable. The fact of the matter is my perception of good cause is different than somebody else's perception. And that exception alone ends up being one of the drivers that brings us out of compliance with federal guidelines. And I think that it's important that this committee flesh it out well, but just a blanket for good cause seems to be a little too generous, and we need to set some guidelines as to what a good cause is, rather than having a blanket statement. For some folks, a good cause is, maybe it's no cold out, maybe it's raining out, maybe, the windshield wiper fell off the car. I don't know. But we've got to find a way to make sure that Maine comes into compliance, and that seems to be one of the drivers that's dropping us off that compliance list.
Sure. So that's good cause to not go to a job interview and not be one of those requirements.
That's correct.
Okay. So it wouldn't be a good cause if there was a death in the family.
I didn't go into that level of detail, and I think that that's up to this committee to figure out. But good cause it certainly isn't because it's raining out, or the dog ate my homework. I mean, that was good cause when I was a young fellow in school, but in hindsight, it probably was just a lame excuse.
See no further questions. Thank you very much.
I thank the committee for considering.
Next, we'll hear from Representative Pouliot. Senator Libby will be next on deck.
Senator Libby and I were debating on who would get called first. There's definitely no indication of the pecking order. I'm certain of that.
Well, I just went numerically. You got 133. He's got 1097. So
Nice. Hopefully get my bill in before you then, Senator Brakey, I guess. So this is testimony in support of LD 133, which is resolved to establish a task force on independence and public assistance. Senator Brakey, Representative Bettine, and esteemed members of the Committee on Health and Human Services. I'm Representative Matt Pouliot, and I proudly represent House District 86. I'm here today to present this bill. The resolve establishes the task force on independence from public assistance. The task force is directed to review and make evidence-based recommendations on initiatives needed to help families receiving public assistance move out of poverty to independence through employment. The task force must meet 8 times and will consist of 13 members. They must complete the work this year and report findings, recommendations, and suggested legislation to this committee by December 2nd, 2015. This bill is identical to the amended and improved version of LD 1064 presented last session by Representative Tom Lewandike. The bill had broad bipartisan support, but it was ultimately indefinitely postponed. I don't think you need to hear from me the importance of moving away from reliance on public assistance to self-sufficiency when possible. I am also not an expert on how best to do this. I do, however, believe that there are many among us who are qualified to help us better understand how to do this in a sustainable way, and it's the goal of this legislation to create an avenue for that to occur. I thank you for the opportunity to present this legislation and be happy to answer any questions.
Questions for Representative Pouliot? Seeing none? Thank you very much, Representative. Senator Libby.
Senator Brakey, Representative Bettine, members of the Health and Human Services Committee. I'm Nate Libby, and I proudly represent the people of Lewiston in the Maine State Senate. I am here to present LD 1097, which is an act to improve the integrity of Maine's welfare program. This legislation basically seeks to address 4 separate issues related to TANF Aspire benefits. The first is to limit TANF funds and their usage to within the state of Maine, but it includes an exemption for the state of New Hampshire. This is modeled after the state of Minnesota that's wanted to limit use of their benefits to within state borders with an exemption for bordering states. In Maine, it's a lot simpler. Our bordering states are just 1. So New Hampshire is included, and this is in recognition of the fact that a lot of folks who live along the New Hampshire border who are Maine residents live closer to grocery stores in New Hampshire than they do in Maine. The second piece of this bill is to limit the use of TANF funds to certain purchases that many of us would view as necessities of life rather than luxury items. And those items that I've spelled out in this bill include tobacco, liquor, lottery, gambling, bail, firearms and ammunition, vacation, tattoos, and adult entertainment. And if you want to laugh, you should read about how adult entertainment is defined in the bill. I thought it was kind of humorous. Number 3 is to limit the amount of cash that can be withdrawn on an EBT card on a monthly basis to 25% of the benefit. When you look at number 2 in my testimony on how you police this kind of law, I think number 3 is key to that, and that in today's world, 100% of cash benefits can be withdrawn from an EBT card, and at that point the state really has no idea how those funds are being spent. I think in today's world, in the year 2015, the vast majority of our transactions that are going on are done electronically. That's obviously not the case for all transactions, so I've offered that idea as something for this committee to mull over. Number 4 is authorizing DHHS to hire an additional 5 fraud investigators for their fraud investigation. I would just say that on the committees that I serve on, we spend relatively little time looking at personnel and staffing levels within our departments. I feel like with the pace of legislative session, you are plowing through as many bills as possible, and your time looking at the budget and staffing levels is relatively limited. I can't say for sure whether the department needs 5 additional fraud investigators. I do know that recently, I think it was in the last 3 years, the department hired an additional 8, and that was an attempt to try to get through some of the caseload that was building up. I think in the State and Local Government Committee, a member of the House has offered a bill to look at understaffing of all state agencies and state departments, and whether
whether this can be part of the conversation for your committee, I'm hopeful. So I'll wrap up by saying that, I think a lot of these ideas in this bill was presented in the 126, and they failed to be enacted. I think we have to try to find the right balance between protecting the safety net that our neighbors and our families use, but making sure the safety net's accountable. And my final point is that a bill like this that I've put together, I know is going to be opposed by social service advocates and by welfare reform advocates. And sometimes when opposing sides are against a bill, that means nothing more than you've got a really bad bill. I'm hopeful in this circumstance that it means you maybe struck the right balance. So with that, I will conclude my testimony. I appreciate your time and consideration. I'm happy to try and answer any questions.
Thank you, Senator Libby. Any questions for Senator Libby? Or Senator Haskell?
Thank you. Nice to see you, Senator.
See you.
The question, and this is coming from several, is limiting the amount of cash that can be withdrawn.
Right.
It's a monthly benefit,
Mhm.
so this would be a monthly update. Have you talked to any financial institutions to talk about how that process could occur? What's required in order to limit by individual card, which has more than one thing on it, a percentage, and how do they know what it is on a monthly basis?
Of the 4 pieces of my bill, this is my least well-researched piece. I looked to Massachusetts for the limitation on TANF purchases. I looked to Minnesota for the in-state, out-of-state piece, and I looked to what Maine did on hiring fraud investigators. I do know there are probably some implementation issues, but I didn't want those limitations in my little time that I had to prevent the conversation from happening. So.
Any further questions? Representative Vashon?
I'll ask you the question because it sounds like you've been looking at a lot of different states. Which state do you think is the champion at managing welfare benefits?